Good afternoon and a very warm welcome to day 8 of the Learning Conclave for parents as we celebrate the 10th year of Intelligence Plus. It's a delight to have so many different wonderful speakers over the last 8 days, empowering parents with the right methodologies, with the right skill set, with the right... Good afternoon and a very warm welcome to day 8 of the Learning Conclave for parents. Empowering parents on different methodologies, knowledge, right frameworks, techniques to help them be more empowered, confident, and intentional parents, raising more confident, joyful, and happy children. And we're so delighted to have another wonderful speaker today on a very critical topic that every parent at some point has a lot of questions on, which is oral care, health care related to the teeth, the ages, the problems, the teething issues, the food, everything related to oral care, right from when they're young to when they are having the first permanent ones and so much on. And a very little, while we feel we know, there's very little accurate knowledge about these things which are so important. So for this, we have today's speaker, Netika Budwani. Welcome to be on the part of the Parenting Conclave for by Intelligence Plus. A little introduction about her. She has played many roles, but she's a mother to two girls, to being a pediatric dentist and a passionate blogger under the handle Tooth Fairy X Mommy, where she talks about dental habits in children, healthy dental habits in children. She loves sharing recipes on child and toddler nutrition as well. She has an experience of 12 years exclusively working in pediatric dentistry and loves to spread awareness on prevention of dental decay in her practice and on her blog. She's an avid art lover and loves to paint in her free time. And of course, she's run around the kids enough. So without further ado, thank you so much, Netika, for being with us today. It's an honor to have you. And for all the parents who are going to be watching us on YouTube Live and thereafter, I'm sure you're going to take enough notes to this. We'll first have her share her inputs about dental care and the issues, and then we'll take up with questions towards the end of it. Thank you so much. Over to you, Netika.
Good afternoon, everyone. Thank you so much for the nice introduction, Pranjal, and thank you, Intelligence Plus, for giving me this opportunity to... Okay, hold on. My kid is just crying. I've been in the room. Just give me 1 minute. Moni?
Of course, as parents, we understand that there's so much more that we have to manage simultaneously. So yes.
So yeah, today's topic, as we had mentioned, is oral care across, in different ages. And so in today's topic, I would like to talk about age-wise brushing and the prevention of decay at different ages of life. So, let's be honest about this, but oral health is something which is the most ignored health. The rest of the body, people take care, you take care of your skin, you take care of your hair, but oral health care is something where, it just gets ignored. Primarily, this could be because of fear of going to the dentist, which usually adults have, and the feeling which they come up with and they pass it on to their kids that, dental experience is something which is not very pleasant, or, something like that. And that those fears, those talks come into the kids' mind, and it works on their subconscious. So when they go to a dentist, they have this preset idea that, going to a dentist is going to be unpleasant. So yeah, let's change that in the coming generations is what my idea of bringing on oral health is. Also, one more thing, that the oral cavity, the mouth, is the mirror to the whole body. So whatever, there are many diseases which can be diagnosed and they also reflect, they give their symptoms on the mouth and the gums. And even diagnosis of a lot of diseases can be done much earlier before they even show other symptoms on the body. So something like oral care should not be ignored. And also the main thing would be just instilling a healthier attitude in children. So we have better adults in the near future who are, aware and also are willing to, and the cycle of neglect, which we usually have people having a lot of treatments, and that cycle of neglect is something that we need to break in the coming generations. So yeah, so now the main thing would be to start young. So anybody would ask me that how young can we start this, how young can we instill a positive attitude? And trust me, my answer would be, it starts in the prenatal care. When the mother is expecting, that's when the mother has to take care of her teeth, her gums, her nutrition, which will be passed on to the child from that there itself. So in the prenatal time, if there are any nutritional deficiencies in the mother, like a vitamin B deficiency or vitamin D deficiency or calcium deficiency, these can impact on the child's teeth. So when a mother is expecting, make sure you have no deficiencies. Also, because of the changes in the hormones, the mother is prone to having periodontal problems and teeth decay. And also when there are some mothers have hyperemesis where they're vomiting so much, so the acid content goes high, and a lot of sequelae happens where they are the teeth become more prone to decay. So it is very essential that in the second trimester, mothers go to dentists and fix their problems, or if there is any gum swelling or decay that is happening, please address to it. Also, another thing is that when they have decay in their mouth, it is required that they treat it before the child is born, because when you kiss the child, when share spoons with the child, or you're feeding the child, the bacteria tend to go from the mother's mouth to the child's mouth. So it's imperative that they clear out all the issues earlier. Also, a pregnant mother should take care of all the medication she is having. Make sure that none of these medication will stain the teeth, because there are some medicines, some antibiotics, which can permanently stain the teeth in the future, meaning the kids when they are born. Because all these teeth are getting developed when in the mother's womb. Even though they develop much later, they come out, they erupt much later. The development is happening as early as 12, 13 weeks of intrauterine life. So it's important for that. Now, once that is taken care of, baby is born, just make sure the child doesn't have natal teeth. There are something known as the natal teeth, which is natal and neonatal teeth, which the child is born with a single tooth in the mouth or two teeth in the mouth. Now, there are a lot of superstitions regarding these teeth. Some say that, this is the devil's tooth, or the kid is not lucky for the family, or vice. Another way would be the child is super lucky for the family, of course, but that is irrespective. Now, those teeth, if they are present, they are usually very loose because there are no roots to those teeth. So they can be aspirated by the child when the child is breathing or feeding, or can get ingested or get aspirated. So if that happens and you notice it, usually hospitals only schedule a checkup with a pediatric dentist at that time, and the tooth has to be removed. It's a very, very small procedure, and it can be done within like 5 minutes. But of course, awareness is very less, and parents usually have no idea, and they come up with something like this, a natal tooth, and they get worried. And there's a lot of other sequelae, and there are so many families, relatives, everybody is just giving their own opinions, and there's a lot of confusion that is happening. Okay, so now if at all the child doesn't have any teeth, which is good for you, and so then the first tooth that will erupt will be around 6 months of age. However, it is important that even before the tooth erupts in the mouth, mothers should take care that they they use a soft cloth to clean the gum pads of the baby after every feed. Now, mainly it is because we don't want any accumulation of milk happening in the gum pads. That could lead to accumulation of bacteria. Uh, Also, there's something known as oral stimulation happening with the child. So basically, you're getting the child used to being, there is some kind of that this is going to be there, like you're going to keep cleaning it, and it'll become a forming kind of a thing. So when you start brushing for such a baby, things will be much more easier than someone where you introduce a toothbrush at 1 year of age. So oral stimulation is also very important. Cleaning the gum pads is important. Um, so now the first tooth eruption we'll talk about, which happens around 4 months to 1 year of age. Um, Before that, of course, I'm sure the parents would have gone through a lot of teething issues, drooling, maybe fever, loose stools, which is very common, which is associated with teething. Now, there is no medication which is required for teething. But if at all needed, you can just give those homeopathic pills under the name of, I mean, it's quite a over the counter, but the efficacy of that is not very well established in studies. So we don't know whether they're working or it's working as a placebo or how is it. But just make sure whatever teething medicines that you're using should not contain mercury, because the older ones which they had lead, high quantities of lead and mercury. I mean, the ones which there's some kind of a powder which is available, and I don't know, this happens in the lower socioeconomic strata, I guess. So kindly avoid all those powders. And even if you're giving anything, check labels, see what is the content of the thing. If you're unsure, please don't give anything to the child. And try giving natural methods, like your own finger can work as a very good teether. When you're sitting with the child, just give a clean finger. The child will just chew on it, and it's good. Cold carrots, breast milk popsicles, cucumbers, teething drinks, teething toys are a good idea. Teething necklaces are also nowadays available. So those are better ideas, and try and go for whatever um, natural ways as you can instead of giving medicines. So once the first tooth is erupted in the mouth, the brushing should start from then. You have to start brushing the teeth from then. So something which is like I'll show you, like a finger brush is what you should start using. So this you can actually you can even use this as a teether. So you can start introducing it when the child is teething. And once the first tooth is erupted, a rice smear toothpaste, chawal ke dane jitna toothpaste has to be taken, and you can just kind of just massage the teeth with this kind of a brush. This is also very easy for the child. You can just give it to them, they'll bite on it, and they'll be very happy as well. So now the thing is, American Academy of Pediatric Dentistry and American Academy of Pediatrics recommends that once the first tooth is erupted in the mouth, 1,000 ppm fluoride in a rice smear is important, and it can be introduced to the child. So another thing is, there's a lot of controversy, of course, around fluoride. But if you are not living in a high fluoride area, which in India are very few, you have to use a good amount of fluoride, which is required. 500 ppm doesn't do it. Zero non-fluoridated toothpastes are not as good for prevention of dental decay. So you have to use 1,000 ppm fluoride. Now, another thing would be is a lot of patients come and ask me, how do we search for a fluoride toothpaste? So you just have to read the contents. Now here, suppose it's written, contains sodium fluoride. This is Colgate Total toothpaste, says contains sodium fluoride, which is 1,000 ppm max of available fluoride when packed. So you have to read the labels and read the content of fluoride. Every toothpaste will have the content written on it, on the toothpaste as well as on the box it's written. Both places it's written. So you have to read the labels properly, and you have to give 1,000 ppm of fluoride, which is important because rice smear between 6 months to 3 years has to be a rice smear, chawal ke dane jitna, where you just touch the toothpaste and on the brush and leave it. Between 3 years to 6 years, the amount will increase. It will go to a pea-size amount. And after 6 years, it needs about half of the toothbrush, which has to be covered in toothpaste. You have to take the toothpaste and just spread it across on the brush and then start brushing the teeth. Now, once you use fluoride, you just have to spit out the toothpaste for the child. If the spitting is not possible until 2 years, the spitting reflex is not developed in a child. So you have to use a cloth and just wipe the toothpaste, but no rinsing is required for toothpaste. That why we don't rinse is because we want the fluoride to get absorbed by the tooth, in basic words. So there are two kinds of absorption that will happen with the fluoride. Once is it's getting absorbed within the tooth, and also the excess amount which is getting ingested through the saliva. So the one which is getting absorbed will stay in your saliva and the tooth per se. So it will help in the remineralization of normal day-to-day attacks. And the one which is getting ingested will help in the developing teeth. So when a child is born, as I told you, the primary teeth are getting developed. When the child is around from first year till the 12, 13 years, in the jaws, there's development of the permanent teeth happening. Of course, at different timelines, each tooth has a different timeline. So at that time, the ingested fluoride will get incorporated through the bloodstream, help the tooth in proper mineralization. So you have a strong tooth which is getting developed with the fluoride toothpaste. Okay. Another thing which all parents really complain is about how to brush the teeth, how to in a toddler. So I have the brushing positions are very important, because how you're going to hold the child. If you have a child with you, um, and you're just brushing uske samne, the child is in front of you and you're brushing the child's teeth, that the child will just keep going back, back, back like that, and you won't get enough support for that. So primarily have the child's head supported, whether it is on a pillow. Suppose your child is lying on a pillow and you can just brush the teeth. Here, it is not really necessary to be around a basin, because initial 2 years tak to there is no spitting reflex that is there. You just have to let the child be and let the child be comfortable. So your brushing position primarily matters here. So, and if you're standing behind the child, then you stand behind, support the head on your chest with the child, and you brush the teeth. Now, brushing has to be done where you have to lift the child's lip and brush in the front part of the tooth. Now, that is the front area. This much is in a child is the most ignored area, where people tend to brush. They brush the piche ka ho gaya, ye front is left. And this front is where the decay will occur, most of it. It is so common that, meaning every other child which we see in the clinic has these front teeth, decayed. So you have to lift up the lift up the lip and brush the teeth there. Also, motivation is another issue which parents face. Now, why motivation is, what are the ways to help the child motivate? Firstly is oral stimulation, like you start brushing using gum pads on the child meaning much earlier. And if that doesn't happen, and of course if your child is already 6, 8 months, 9 months, and you haven't done all of this before, and you're going to introduce a new thing to the child might not accept it, because these are new routines. Brushing is a new routine for the child. Oral stimulation, which he's not aware of or not used to, they might not like the sensation of something being put in their mouth. So the child is going to reject it, definitely. So there, the patience levels of a parent are going to be tested, because the doctor is telling you you brush every day, the child is not accepting it. So there is a kind of a contradiction that is happening, and you feel stuck as a parent because you have to do it. So what I suggest is, in such a thing, that brush the child's teeth even for whatever seconds, 1 or 2 seconds he's letting you brush, because that will be habit forming, and avoidance of brushing will cause more rejection of that oral stimulation. So even if it is 1 or 2 seconds, like a habit forming thing, that you have to do it morning and evening, whether he likes it, he's crying, just be persistent. So your habit for the child is formed. And of course, if you've read about habit formation, it takes at least about 3 months for everyone to make a habit. Basically 21 days, then goes up to 3 months to have a proper habit. Same applies for the child. Also, see, the morning brushing is still okay. There are a lot of kids who wake up crying, so they are not really in that frame of mind to brush their teeth. And also the brushing happens at bedtime, where they're so tired throughout the day that they reject brushing. So what you see is physical behavior, or you see crying, or you see rejection of the habit of the stimulation. But what you don't see is, why is this happening? Is this too overwhelming for the child, or is it too the child is tired, or is he cranky, and why is he cranky? So if you take notice the surroundings, notice your day, you'll come up with things that why is it happening. And then of course, when the child is calm, have a word with them, why we are insisting on brushing, what is the importance of brushing. And also another thing is, make brushing as a habit, like a family habit which is happening. You brush with the child, the family brushes as a brushes together, so the child will ape your behavior and copy you and go on. Also, they feel lack of control when you are the one brushing the child's teeth. They feel they don't have any control with them. So in such a thing, what I suggest is giving the child a toothbrush, and you use a toothbrush, a two toothbrush method, where one of whatever the child chooses, give them an option of choosing one brush, and they hold on to the brush. You use the other brush to brush the child's teeth, and then whatever the child wants, either before or after, if he wants to brush his own teeth or her own teeth, you give them that time, and they let them also do it as well. So of course you are brushing, and the child is just playing through, getting the stimulation, getting used to the feeling of a brush in their mouth. um so yes, a toothbrush technique basically occupies, and it also keeps the child's hands occupied, and it distracts all the attention and gives them the feeling of being in control. Also, another thing is that if the child has been good with the brushing, so please address that good behavior and compliment them, encourage them, so then they know that you're basically you're just like with them, and you're kind of very very good with the meaning accepting accepting this kind of stimulation. um So, as I mentioned, so as the child grows up, now we've talked about the toddler age of brushing. When the now another thing which a lot of parents tell me. So I had a patient recently who was 3 years old, and the mother comes in and says, so he's not brushing the teeth properly. So I asked her, I was like, does he eat the food? Does he eat his own food? So she's like, no. So we have to feed him. And I was like, how do you expect a child to brush, 3 years old, brush their own teeth on their own? They don't have that dexterity. They don't have those motor skills. So AAPD recommends that until 6 years of age, the parents have to brush the teeth. 6 to 8 years, it has to be a supervised brushing where the parent is watching the child and the child is brushing on their own. Of course, after 8, the child can be on their own and brush themselves. But periodically, you have to reinforce on flossing and, checking the tongue and checking whether if there is any plaque which is left out or something. So yeah, another thing that I'd say that there are a few motor skills which you can check, where once the child is able to achieve those motor skills, you can let them brush on their own. Primarily being taking a roti, breaking it and eating, making a bite and eating it. Another thing is tying their own shoelaces. So once they can tie their own shoelaces, they have enough dexterity to brush their own teeth. Okay. Okay, so one more thing that, which is a bit of a controversial thing, because these days everyone is pro breastfeeding, which I am as well. But there is so breastfeeding has the breast milk has these antibodies which will prevent decay, and hence we do definitely promote breastfeeding. But when you are breastfeeding the child, the cleaning of the gum pads, irrespective of the teeth being present or the teeth being absent, is very, very important. And that is because if there is plaque accumulation that is happening on the teeth and you are breastfeeding, and especially nocturnal breastfeeding, where you feed the child in the night and then the child is sleeping off for about another 4 or 5 hours minimum, And then again, you're feeding the child, again, the child is going off to sleep. So you have a good contact of about 8-9 hours of milk being in the mouth, plus plaque being there. Now, plaque is basically a biofilm which gets accumulated on the teeth. Now, plaque has millions of bacteria. And plaque, good thing about plaque is it is very, very easy to clean. You just have to brush your teeth. But if the brushing is not done, you have this soft kind of a debris which you will feel on the child's teeth. Just try it. It's just like an experiment. If you just skip one day brushing, you will see small soft deposits on the tooth. So that can be easily removed. You can just remove it with your nail as well. So the brushing is the best thing you can do. But if you are ignorant about this, or where the brush is not reaching, the plaque is getting accumulated at one particular area, that plaque has microorganisms, bacteria, which will produce acid. Now that acid, because it is stuck to the tooth, the plaque is stuck to the tooth, the acid will go onto the tooth. Now there will be a mineral loss basically happening. When there is something which is acid present on teeth, there is mineral loss, which is known as demineralization, which is happening. Now here your fluoride and calcium present in the saliva come into play, because if there is demineralization, the calcium ion gets stuck onto there, and it will cause remineralization. Now there is a big cycle of demineralization, removal of mineral from the tooth, and remineralization, that is addition of mineral to the tooth, happening on a cyclic basis. But if there is more and more plaque getting accumulated on that particular area, plus there is more acid formation from your diet, from eating more sugary stuff, so that demineralization process will become bigger. Basically it will increase, and there'll be more demineralization happening. So initially you will see as a white lesion. Your teeth won't get brown overnight when you have decay. The first thing it'll be a darker white appearance which will be on the tooth. Now the good point is that particular point, if you notice that decay is happening, it is white in color, you can remineralize it. It can be reversed at that stage. But if there is cavitation happening, meaning it's already, you can feel like a depression or a crater in the front tooth, um, that is when there is cavitation happening, and that needs to be removed and filled with cement or something else. But when it's, as long as it's that white lesion, you can remineralize it, and that would be the best way of reversing dental decay. uh, okay, so now another thing which I had mentioned earlier, a bit of it, was that a lot of parents say that a baby's mouth is clearly sterile, so how do the bacteria come in the mouth? So as I said, it's from the initial colonization will happen first. So as soon as the first tooth is seen in the mouth, uh, naturally it just gets colonized. There are new, like how we have gut bacteria, there are some bacteria in the mouth as well. So they start forming, they start making little colonies, and a normal immune response is good enough to keep these bacteria to be at a normal stage, where they are being good, and they are not causing decay. But when the oral hygiene habits are compromised, along with prolonged breastfeeding, that's when the problem occurs and the decay is caused. Also, with mothers or other caregivers who have decay in their mouth, and you're feeding the child and you're blowing on the food to make it cold, and then you're feeding it, so the bacteria actually comes from the mouth, and you're giving those bacteria to the child. So that is also so it's a communicable, you're transmitting the bacteria from one person to the other. So if you have your caregivers, and whoever they are, make sure they have good teeth, so the decay doesn't get passed on to the child as well. Yeah. So also another thing I'd like to say is about the nutrition of the child. So now nutrition is also very, very important for prevention of dental decay. Usually this is for the snacking that I'm talking about, because snack time is the time where you're giving in the child a lot of sugary stuff, like biscuits or chocos or these cereal. So breakfast is one where I know these days kids have a tendency of having a sugar based cereal, And the other thing is what I see is tea time, where they skip a fruit or a nuts, and they instead have like biscuits, chips, or something unhealthy. So this once in a while is okay, but then making it a habit um, is not good. So we have healthier options you can choose between try and give as much as natural fruits and vegetables, raw vegetables possible, because the raw vegetables and fruits have a cleansing action on the teeth. It naturally cleans up all the plaque on the teeth, and also gives a stimulates more saliva. And because of the harder texture, which is lacks in a processed food, they help the jaws develop, because you're chewing them, you're putting in efforts to chew the fruit or vegetable. It will also help in developing the jaws. There's also something known as a sugar clock concept, which is basically the amount of sugars that you're giving. So you don't see the quantity of sugars. You have to see the attacks that you're giving. So suppose you have a big slab of chocolate, and what mothers do is, don't have the full chocolate at one go. You have one piece now, you have one piece after, say, 2 hours, have one piece after 4 hours, which is absolutely wrong, because you're exposing the teeth and the mouth to sugars at multiple times, and that will cause decay. You would rather give a small slab and let the child finish that much chocolate for in one go, and then say, now you're done for the day, no more chocolates for you, rather than keeping a piece in the fridge, keeping half a piece in the fridge, and giving multiple attacks. um what else? So why we say that is because every time you eat anything in the uh, whatever you're eating, your basically salivary pH will go down. It will become acidic. We are at a neutral to alkaline pH in the normal state. But whenever you eat something, the pH of the saliva goes down. So it becomes acidic, and it takes about 20 minutes for the acid level to become back to neutral again. So that is why we tell them that your multiple attacks will the pH is what is going to play a role in this, and it will cause. So that's why when the child is snacking more, they have a tendency of having more caries. And also it's a familial thing. So the families which are there, which have a habit of snacking in the house, you will notice that the families have a similar pattern of decay. And families which are more healthier, have healthier options to eat, they have a different pattern of decay present with the child. So yeah, also for parents now, I'd say that please notice the hidden sugars in the food. So things like cereals, breakfast cereals have a lot of sugar. Ketchup, your sauces like barbecue sauces, they have a lot of sugar as well. So just read your labels carefully, and anything above 4 to 5 grams of sugar would be on the higher. They would be considered on the fairly higher levels. So that's it. And in conclusion, I would say it's better to develop healthier habits than treat decay. So as long as you are preventing and developing better habits, and the decay can definitely be prevented, because decay is something which is 100% preventable.
Perfect. Thank you so much, Nitika. There is so much that even I took home as an educator and a mother. It was really well structured, and I loved how you beautifully brought out the importance right from a prenatal age. The importance of parents having good, mental dental care right from that age. So we already have a lot of questions that had come in earlier itself when we asked it out to our parents, and of course, we take up a few more now. So the first was, and this is the most common myth that we have, that teething causes fever.
Yes.
And while you spoke about the medication and the teething, parents have this constant thing that my child is in that teething phase, putting everything in the mouth. So can you talk a little more about that and ways of how that can be reduced, or how do we fulfill that sensory need so that they don't have everything putting in their mouth?
Okay, so basically, fever because of teething doesn't happen. Theoretically, that doesn't happen. The only fever is because the child is picking up things, so it could be a stomach bug that is happening. There could be slight inflammation around the tooth when it is about to come out. At that time, you can give a mild Calpol or ibuprofen under a doctor's guidance. You can check with your pediatrician if they give it, or whatever Meftal or Combiflam or something like a syrup which you can give over the counter medicines. But don't make it a habit. You can give it as a one-off thing. Do not make it a habit to keep giving it over and over again, because of course it doesn't make sense to give so early. As I said, natural teething methods are better, and try and keep the child in a cleaner place, or have the child being observed. Like there is some caretaker who is observing the child, making sure the things are not falling and he's putting those dirty things in his mouth. um, Toys which are there with the child usually plays with, you can clean them often as you can, because those toys are the ones they are putting in their mouth. The teething gels, teething rings and teething whatever toys they have, keep washing them at least 2 times or 3 times in a day. So all these, once your external surroundings are cleaner and you are taking care of the things that they are putting in the mouth, that would be good. Another thing, what I have done for my own children, I know it's a bit controversial, a lot of people do not prefer doing that, is giving a pacifier. Um, it is something which is, a lot of pediatricians go against it, but as pediatric dentists, I definitely recommend a orthodontic pacifier for some time, because children have this oral reflex. Like when a child is born, when you see that, even in the scans, you will notice the child is sucking the thumb. So they have this oral kind of a, they get like satisfaction while thumb sucking, or sucking something. So that's why breastfeeding also is one thing where the child is prolonged. They continue breastfeeding for very long in a lot of kids. Like, they continue till one hour, and you're just wondering why is the child just sucking so much? But they have this sucking reflex which is there. And to address to that reflex, pacifier works very well. Of course, there is another uh, cons to the using the pacifier is how to eliminate it, but that comes in much later. But if you can eliminate it around 9 months, before the 9 months of age, it is very, very useful for a child to give a pacifier. It also helps in teething. So teething meaning they just kind of bite on the pacifier, and it gives that feeling where they are sucking, and also the feeling of kind of they get like irritated, agitated, angry when they cannot do anything about it. So that thing of biting something harder is also taken care of with the pacifier. And of course, a finger brush is ideal. You get these different teethers as well. Like I had a shape with the shape of a banana. It has a little brush, silicone kind of a brush in the top, and you can hold the two hands. So even that, those are doing very well. There's a giraffe toy which is also quite famous for the teething. So yeah, I guess that answers it all.
Perfect. So the next question is about when parents are breastfeeding, because, like you discussed, we breastfeed and the child is sleeping, then goes to sleep. Or they best breastfeed and then go to sleep, right? That's like the last feed of the day. But then there is milk, the plaque will get accumulated. So how do they work around that? Should they have water before that? Should it be cleansed? Or is it okay? Especially with a lot of parents now also continuing to feed for a little longer. So how do we address this?
Irrespective of the child's age, you have to, once the teeth have come in the mouth, so morning and night brushing is what is required. And in between, after every time you feed the child, breastfeeding the child, just keep a cloth next to you. Like I know breastfeeding mothers usually keep a snack, keep water bottle, keep a cloth also with you, a soft muslin cloth, wrap it around your finger, and then just clean the child's gums or teeth, whatever is there, just kind of clean upper and niche properly. That's all you need to do. That's all. And that is, and even when the child has fallen off to sleep, make sure you do that. I know it could wake up the child as well, but if you make it a habit, the child will stop waking up, or they will not fall asleep until you clean their teeth. So, that also happens. So, keep a cloth with you every time you're sitting to feed. So you don't have to really get up, and just clean it and put the child to bed or however, and then you get up and get doing your tasks. But cleaning of the gums and the teeth is really, really important. If not done, then the breastfeeding can work against you. Yeah, with the teeth getting decayed. Also, not just breastfeeding, with bottle feeding moms as well.
Yes, I was going to come to that as question. What about bottle feeding, and till what age should they do? Does it affect the teeth formation and structure if the child is bottle fed for very long?
Yeah, so bottle feeding should be stopped at 1.5, 1 year of age. You can extend it to 1.2, 1.3, but not beyond, definitely not beyond 1.5. Um, because see, now the thing is, when a child is breastfeeding is harder to do than a bottle feeding. So when the child is breastfeeding, his entire musculature around is working. It's making an effort to suck out the milk and have it. With the bottle, it's much easier. A little press and the bottle will give out milk. So the development does not happen as well. That is one thing. But of course, now if you compensate in the future with good amount of natural foods, that can be compensated, of course. And even the comparison wise, I don't think there's much of a difference as such. But bottle feeding mothers also have to clean the child's gums as and when they feed. Once it's over the bottle feeding, and you can do. But stop the bottle definitely at 1.5, not more than that.
Now the next question is, so what, like parents just curious to understand what leads to improper teeth, like this, especially once their milk teeth are going off at around 7, 7.5. What is or how does it prevent irregular formation of teeth? Like some are coming crooked, aage piche. So how do you prevent that, or what is responsible for such kind of teeth?
Okay, so why almost all parents will tell you that my child's teeth are crooked. It is because the milk teeth have come in smaller jaws, and then at 6, 7 years you are getting adult sized teeth, because once the 6, 7, 8 years the teeth that start, they are not going to change, they're not going to get replaced, and their faces are small and the teeth are big. So also there is lack of space. The jaws are small, the teeth are big. So that tooth size, jaw size discrepancy is going to be there. So until they grow, until post puberty or something, you will feel their teeth are really big. So that is a normal thing. In many kids, the growth of the face will compensate for that, of course. But in cases where it doesn't happen and the compensation is not happening, braces will be needed. And that almost a lot of kids require braces. It's more like an evolutionary change that is happening. Our diets over the years have become more processed, where the people initially, when the Neanderthal man used to eat more of raw foods, pick up things from the trees, eat meat, all that has changed. It has changed to having a very, very processed diet. So that has not let the jaws develop as much as they were a couple of centuries back. So that evolutionary, the tooth size hasn't gone down. The jaw sizes are becoming smaller. So that is why a lot of kids require braces. But a good time would be around 12, 13 years, where the teeth are permanent to start. But if there is very severe change, the tooth is really, really malaligned, and a lot of severe malalignment you can see, then it might be needed to do it earlier to use the growth of the child and to make changes in the teeth and the jaws.
So there are some myths like that when the new teeth is coming, if you keep, because there's this sensory need of a, like this sensory urge. So children, a lot of like tongue it around, and the teeth is coming. Does that cause it? That's like very common myth that I've seen.
Yeah.
The
No,
shape is
no,
crooked because they kept putting their tongue towards it.
no, not at all, not at all. In fact, there are so many times there is something known as over-retained teeth, where the tooth hasn't fallen and the new tooth has come in. So we tell the parents that please tell them to shake it when they're doing nothing. Just try and shake the tooth a little more. So, that is what we tell them to do as well. So it's
Okay.
definitely a myth.
Okay. There was this question that had come on was that some kids get their teeth late and their milk teeth also fall off late. Is that a cause of concern?
No, another like a window. See, usually the teeth will start changing from around 6, 7 years. The lower front will get changed. In some, it is earlier, like 5.5. Also, kids, the tooth has fallen and the new permanent teeth have come. So 5.5, 6, 7 is a good age. Beyond that, you could be worried, but usually they'd come in, meaning you can, for your own sake of happiness, maybe do an x-ray, like a full mouth x-ray, and see if it's beyond 7.5 or 8, there's no teeth that have been changed, then you can do that. But usually some kids are slower, some kids are faster, unless you have any kind of thyroid issues in children. If there is any endocrine issues in children, then it could be delayed. But as long as nothing systemic is present, like there is no underlying issues, then I think it's perfectly normal. Even till 8, it is fine.
Okay, lovely. Um, there was this last question on types of brush. Especially like you talked about finger brush and stuff, but once the kids are a little older, are there any specific brushes that
Yes.
you recommend age-wise?
So mainly, you can look at the bristles of the teeth. Uh, there's also, so this was one, my daughter is 3, so I mean, I use like a bigger brush for her. But in between this size and a finger brush, you get something for 1.5 years. I think Pigeon makes that. Pigeon and Kiko make that 1 to 1.5 ear ka brush as well. So the head is smaller, which helps with the teeth. There are also some silicone brushes which are available where the head, like this is a bristle brush which has bristles. They have silicone kind of projections on it. So silicone for 1 or 2 teeth, it's fine as long as 1 or 2 teeth are there, and it's more like for an oral stimulation. But if there are multiple 4+ teeth which are present in the mouth, total of 4 and above teeth in the mouth, then I suggest change with a bristle brush. Parents can also start with, suppose, there could be parents who have not started brushing until 1.5 years also. So starting off immediately with a bristle brush is not a very good idea. You can start with a silicone brush where they can, get used to the oral stimulation and, get used to the feeling of a brush in their mouth, and then eventually shift to a bristle brush. um, Head sizes will increase as the child, with age. So keep going according to the child's age. And also, once the bristles start fraying, please stop. Don't use that brush. And uh, once the bristles, if they are fraying very, very often, if like in a month's time the bristle is completely frayed, then that means you're putting too much pressure on the brush to, do that. An ideal time would be around 2.5 to 3 months where the bristles are fraying. So just keep that in mind and change the brush every 3 months.
Lovely.
And of course, after illnesses as well.
Sorry, and the last one was?
After illnesses, like if a child has had a throat infection or something, just change the brush after that as well.
Absolutely, absolutely. And there's one last question that was there, while I'm coming earlier, was, let me just read it out. So, is there any specific diet to help development of better, stronger teeth? You mentioned about the food we shouldn't be having.
Just whatever you make in the house, whatever is natural, is the diet that we would give. Include as much as natural things in the child's diet. More of raw vegetables, fruits, nuts. That includes it. Any store-bought product or anything that comes in a packet is not what you're supposed to give to your child. So just give as much as natural stuff, and especially what you make for your own child. So don't make Maggie when the child is hungry. Just make something else. Try and make like a dosa or idli or something which has been in our diet for over the years. So just a little effort from the parents will help in developing healthier habits. And you know, I mean, for the best thing would be just stop buying biscuits. Of course, we also need to change, because it's a lot of mothers who will say that I have a habit of waking up to a biscuit and tea or something like that. So
Yes.
you yourself have to make those changes to make the whole family follow that.
All right. Okay, and the last question that's come up right now is, what about tongue cleaning? Should we encourage children to use soft tongue cleaners from a young age, like 2, 3, 4, whatever,
Um,
4, 5, 6?
when it's a small baby, 1 till 1 or 2 years, the cloth is enough. After that, just use the brush. Tell the child to just put the tongue out, and you can use the brush to clean the tongue, and then tell them to rinse it, spit it out, whatever. And yes, a small, I don't know, I have not really used tongue cleaners for my children, so I don't know how feasible they are. As far as I think, using the brush, or there are some brushes which come with a cleaner at the back,
Yes.
so you can use that as well. I am not really sure of those tongue cleaners, because some of them are very sharp, and you kind of tend to, make.
Get the plastic ones nowadays for, which are
Yeah,
abused.
I haven't come across that. I'll check it. But usually, what I do for my children is just use the brush on the tongue as well.
Okay. And of course, just to for everyone's knowledge, you're from a pediatric perspective. Of course, I know about it, but yes, from a perspective of the usage of mouth fresheners.
Yeah.
By what age is it allowed?
Mouth. Do
Like
you
if
mean
Listerine,
mouth washes or like chewing gums or something like that?
body, the mouth, like Listerine and all of those.
Yes. So any alcohol-based mouthwashes are not recommended. And mouthwashes which are like medical, if a doctor gives it to you, they'll tell you that just have it for 15 days and stop it. Like something like chlorhexidine, if you have any periodontal issues. Uh, 15 days to 21 days is the time they'll give you, and they'll tell you to stop. Alcohol mouth rinses are not recommended, and any kind of mouth rinse technically is not recommended, because it um 1 second. Yeah. So because it changes the normal oral flora, like I just mentioned, you have a gut flora. Similarly, you have a oral flora, which is basically helping you keep a good, healthy mouth, preventing decay on a daily basis. But if that is changed, the flora is changing. So a lot of things will get affected, even like the decay, basically everything. The normal flora is required in the mouth for healthy being. And if you keep using mouth rinses, alcohol mouth rinses, or medicated mouth rinses for longer than a couple of, I mean, if it's recommended by the doctor, yes, but more than that, it is not advised. So your brushing is more than enough for that.
Wonderful. Thank you so much, Nedika. I think a lot of questions have been answered in your conversation and now through the Q&A. It was wonderful, absolutely insightful, knowledgeable, concise and precise in terms of the needs of a parent to understand better oral healthcare. And I loved how you give it with a bit of research as well. So, parents have the understanding behind what they're doing and why they are doing it. I absolutely loved it. I'm gonna keep recommending people to go back to this, live YouTube video so that every time they have a question, I know, just refer to this and go back. And for all those who are watching us and who will watch us, in case you want to check out more oral healthcare tips and other tips as from a dentist perspective, from a periodic perspective, technical issues, you can check out her Instagram page, which is called Tooth Fairy X Mommy, or reach out to her for more details. So thank you so much. Once again, it was wonderful. I think the whole parents.
Thank you, Pranjal. Yeah. Thank you so much for having me.
Thank you. Thank you so much, Netika. It was an honor to have you today.
Thank you.